Sometimes people have serious problems with their heart and the arteries that go into it. An angiogram helps doctors look at blood vessels of the heart. If your doctor recommends a coronary angiogram, the decision whether or not to have the procedure is also yours. This patient education module will help you understand better the benefits and risks of this procedure. Symptoms and their causes. Cholesterol deposits accumulate in the coronary arteries, forming a plaque that narrows the artery. Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could cause heart attacks. This is the cross-section of a normal blood vessel. This is the cross-section of a normal blood vessel, and this is a cross-section of a blood vessel clogged with plaque. If blood flow is reduced enough by cholesterol deposits, the heart will not be able to keep up with exertion. If the condition worsens or the coronary artery becomes blocked, the heart can be damaged. An angiogram is a test that helps show the plaque in the coronary arteries and helps detect any narrowing or blockage. Other tests, such as EKGs or heart tracings, can cause the doctor to suspect blockage in the coronary arteries. However, these tests do not show the blood vessels. A coronary angiogram is the only reliable test that shows the blood vessels of the heart. Procedure. Your healthcare provider may ask you not to eat or drink for several hours before the procedure. If your surgery is in the morning, this usually means no food or drink after midnight the night before. During an angiogram, the doctor inspects the coronary arteries for blockage. The angiogram may be done on an outpatient basis, meaning you will be able to go home after the test is completed. This procedure is done while you are awake. There is virtually no pain involved. You will be asked to lie down on an X-ray table. During the procedure, the heart rate, blood pressure, and vital signs are continuously monitored. The groin area is then disinfected and made numb with a local anesthetic. A catheter is then inserted into the artery through the skin in the leg and threaded all the way up to the coronary arteries. Sometimes, depending on the doctor's preference and the state of your arteries, the catheter may be inserted in a big artery in the underarm or the upper arm instead of the groin. Dye is then injected in the arteries and X-rays are taken. You should stay very still during the X-rays to allow good, sharp pictures to be taken.
The heart is a beating muscle that continually pumps blood to the rest of the body. The coronary arteries supply the heart itself with the necessary oxygen and nutrients it needs to function effectively. Over time, fatty deposits called plaque can build up inside the arteries, clogging the passages and reducing the flow of blood. If the coronary arteries develop plaque, blood flow to the heart can be compromised. If a patient develops heart-related symptoms, such as chest pain, dizziness, or lightheadedness, a coronary angiography may be performed to test for the presence of plaque in the coronary arteries. During angiography, a small incision is made in the upper thigh in order to gain access to the femoral artery. Next, a guide wire is inserted into the femoral artery and is threaded to the aorta. A catheter is then inserted along the guide wire. Once the catheter reaches the aorta, a contrast dye is injected. When the dye flows from the aorta to the coronary arteries, an X-ray or angiogram is obtained. The image taken during angiography will show if there is any blockage, aneurysms, narrowing, or other abnormalities in the arteries. Following the angiography, the catheter and guide wire are removed. If treatment is necessary, the physician can recommend appropriate therapy.